Hello, champions. Welcome back to the second part of our 5-day series of midlife transition. First part, we spoke about what is midlife transition with a focus on as perimenopause and menopause, and then what's going on? Why is it going on? Well, today I'm going to take a deeper dive into the symptoms manifestation and what we should expect and just take it from there. So in case you're stumbling on my page for the first time, I'm Dr. Dalapa Babalola. I'm a family physician who is boarded in lifestyle, obesity, as well as menopause care. And I'm passionate about providing exceptional full spectrum personalized care for all my patients. I have a direct primary care practice in Atlanta, Georgia. So subscribe to this channel, all right? I really want us all to live at our finest well-being. And the only way for people to know is sharing the love, sharing it with them, let them feel empowered, let them, be educated. And so please share, subscribe, hit the button so you know when the next episode is coming out. So let me get started. I would like to use my slides to keep me on track. All right, so we'll start here. So let's talk about what are these three big hormones. Hormones are just messengers that do a lot of bodily functions, right? And they're produced at different areas in the body. So estrogen, as I mentioned in part one, if you haven't listened to it, please listen to it. It'll make more sense. Estrogen is the big hormone, like the ice cream, right? That gives us the feminine characteristics, all right? It also helps to stimulate the endometrial growth. It prepares the uterus for a baby. It also helps with our bone and muscle, lubricates our joints. Yes, and it also supports cardiovascular health because it helps to dilate the vessels. And that's why women in our younger age, before we hit menopause, we have that protective layer. And after that, our increased risk of cardiovascular. And then it also enhances our mood. So it is so important that we give estrogen the glory that it needs. Progesterone, on the other hand, is called the nature's Xanax. And so it has that cooling effect, calming effect. Again, it helps to prepare the uterus for pregnancy, maintains it, it forms that thickened mucus lining, all of that really just to give that calming and soothing effect. And the progesterone is the cone where the ice cream sits. And then testosterone, even though, yes, majority is produced in men, but women, we do carry some testosterone. And really what it helps us do is with libido, with energy, with behavior, muscle mass, and strength. So this is important for us to know. Now, when we take another look at estrogen, I want to point out that we have receptors everywhere. Do you see that over 400 estrogen receptors that are strategically placed in different parts of our bodies, right? The brain, all right? It's also in the gut, it's everywhere. So it's in the heart, everywhere. So whenever we're talking about midlife transition and you have a tanking or retirement of the eggs, all these symptoms are going to be affected. So let's talk more about what that looks like. So our tank is actually empty. Yes, it's empty. It's all the way red. But that's at menopause. But peri is like going like this. It's going like a roller coaster. So the symptoms that you're going to see is going to be based on the estrogen, the progesterone, and the testosterone. So what is happening at in the iceberg, and what do you see on the top? So certainly cardiovascular disease without the estrogen, the heart is no longer dilated, it's constricted, frequent urinary tract infection because the skin, remember I said estrogen takes care of the skin, the hair, the nails, everything. So if everything is dry and shriveled, no collagen, no elasticity, you're going to have a tendency for infections to happen in the vagina area. And the distance between the urethra and the vagina is so shortened that you can have infections and changing the whole microbiome of the vaginal wall. So that's UTI, again, to the point, if your bones are not strengthened by estrogen, osteoporosis, thinning of the bone occurs, dementia, because you will see in the following slide what happens to the brain. It's not utilizing glucose as well, metabolic changes because estrogen helps with the deposition of fat. So in the absence of that, there's a lot of metabolic changes, diabetes, increased insulin resistance, inflammation, cancer risk, sarcopenia, just thinning of the muscle. So there's all of this that occurs, and you see the symptoms above that you would see, progesterone that is supposed to give you that calming effect. People can't sleep anymore. They're having night sweats because of the lack of the estrogen, which helps with the vasomotor symptoms. So there's all these symptoms that you see, and it's really very, very comprehensive. That was just a few of them, but just name it, it can happen. And the irony of it is that there are also other things that can cause similar symptoms. And so trying to figure out, a lot of times patients are treated with antidepressants because they're depressed, but they won't realize that it's because of menopausal symptoms. So that's why it will be very important to take a thorough history. Your doctor needs to take a thorough history. You need to have one that has time to sit with you and figure out, is this menopause, is this perimenopause, or is this thyroid, or is this something else going on? But you see that the list is endless, all the things that can happen to someone. Now, more than that, I mentioned about urinary tract infection, but there's what is called genitourinary syndrome of menopause. And I experienced this. I was like, oh my gosh, what is going on down there? Burning, itching. And I was like, this has never happened to me before. What is going on? And then telling yourself that, oh, you're just getting old, but that's not correct. It's really what is happening is because you've lost the moisture, the elasticity, and it's just red. I had a patient just last week was having similar issues, and it just itching, not sure what was going on. And you need to bring it up. We don't talk to our doctors enough about this. We're ashamed. We feel like something we've done, but it's a diagnosis. It's not a disorder. So menopause, midlife transition is not a disease. It is just what we're going through, but we need to be empowered and knowledgeable about how to manage it so that we can feel like ourselves again. So these are the things that are happening. You see on the right-hand side, how it, you see how it shriggles in the right side. On the left, that is how it looks vibrant, full of, well, I'm trying to look for what's the right word. It's lubricated, it's vibrant, you see the rugour, all of it is right there compared to the right side where you have the loss of the vagina phonics, the thinning of the vaginal wall, and this makes people have all the symptoms that some people don't want to talk about. Even looking for, let's see the anatomy, see what begins to happen. There's redness, there's itching, and even going more explicit, look at this picture. Yeah, look at that. We're supposed to be acidic in the vagina area, but because of loss of elasticity and moisture and thinning of the wall, it becomes alkaline. It becomes alkaline. Yeah, that's the word, alkaline. I'm getting really excited about this because I just love that we know the answers to these issues and not just thinking that it's something that we did or did not do. So genitourinary syndrome of menopause, you see all the different manifestations. There's uterine prolapse. I remember a patient, unfortunately, he was just having recurrent UTIs, you over and over again. And only to do an examination when she came to me, and I realized the whole vulva was red. It was no longer acidic, it was alkaline, and we did the test and then put her on a good estradiol vagina cream, and she did well. Now, other things that has shown increased risk during mid-cycle, again, because of the decline and the retirement of our female hormones, is anxiety, depression, Alzheimer's, autoimmunity. A lot of people are like the things like rheumatoid factors, all those things, autoimmune diseases increases because of the lack of estrogen. Chronic pain has also been shown to increase in high amounts. Now, other things that I want to share with you, certainly I've mentioned a few, is hypertension. So your arteries, you're supposed to have blood flow to the vessels, but if it's stenotic, then you're going to have increased pressure. So not only is there osteoporosis, it's hypertension, there's Alzheimer's, some cancer. So we need to be aware of all of these factors. Now, this is what I was saying I wanted to share with you, the brain. So pre-menopause, does anyone remember what pre-menopause is? It's before, way before menopause. And then peri is around menopause. You see how it lit so well in pre-menopause, and in peri, you don't see that that's the lights, the enhanced light, the fluorescence, you don't see it. And then post, you see how it's diminished. That's because we've lost all those glucose metabolism in the brain cells. So that's what leads to brain fog that people begin to experience. Now, some of the causes of weight gain, which tends to happen, I've had a lot of patients say they have the menobelly. It's for several reasons. Loss of muscle mass. So if you recall, I said estrogen does play a significant role in muscle mass, and as well as testosterone also plays a role. Testosterone helps with the muscle building and muscle mass. But when we lose it, even because of age, after 30, you lose 3 to 8%. And every decade, and even more so when you become menopausal, we lose it. So that would increase the risk of weight gain because muscle is a metabolic driver. And if you don't have it, then you're just having deposition of fat. Another thing is insulin resistance. The lack of estrogen decreases the sensitivity to your insulin. And with the insulin resistance, you can't mobilize glucose from the bloodstream to the organs. Depression and anxiety, yeah, because pretty much all of the estrogen monitors all the serotonin. It regulates it. And if you don't have your feel good hormone, you're going to have that increase of depression and anxiety. And of course, your progesterone tanking, you don't have that calming and soothing effect. And then sleep disturbances, of course, because you're having hot flashes, you're having anxiety, all of these tend to happen. So last slide here, I just want to put it all together that there are other hormones that we need to be mindful of that tends to happen during the midlife transition. Cortisol is definitely one that works in line with our hormones. And that, unfortunately, as much as it's good, it helps us to get things done. But if we're in a fight or flight mode continuously, it can increase our risk for fat storage. And then we have our hormone, if we're not sleeping well, the ghrelin and leptin, those are the ones that regulate our hunger and our satiety. And then, of course, our thyroid gland. A lot of things happen with our thyroid gland. It helps to monitor our metabolism and energy. And then, of course, our insulin. So this is a picture that shows how we lose muscle. You see how beautiful muscle looking at age 25 and see what happens by the time we turn 65. So next part, the next episode I'm going to talk about will share more light into what can we do. You've heard what the definition is, but we're going to talk about what can we do. How can we survive this transition and not feel like the whole world is about to collapse, because that is exactly how it feels on a good day. So stay tuned, make sure you come back, subscribe so that you know when the video has been released. All right, remember that you deserve to live at your finest because you're worth it.